This is Dr. Brandon Erickson. I wanted to talk to you briefly today about labral repair surgery in the shoulder. So for those of you who are undergoing surgery for this, you understand what the surgery entails and then what to expect in the first few months after surgery. The labrum, as we talked about in the office, is a soft tissue covering that goes around the socket part of the ball and socket shoulder. Helps keep the ball centered in the socket. And through either an acute injury or through repetitive forces over time, if you're an overhead athlete, sometimes you can sustain a tear in that labrum. And what happens when you sustain a tear in the labrum is that the labral tear can sometimes flip into and out of the joint and cause some clicking in the shoulder as well as some pain. And what we do when we go in for surgery to fix a labral tear is that we put some anchors into the bone and we run some sutures through the labrum to bring the labral tissue back down to the bone so that it heals nicely to the bone. Now, surgery itself for this takes about an hour to complete, and it's done as an outpatient, meaning you come and go home the same day. And we use a nerve block to help with your anesthesia and pain afterwards, and that usually gives you some pain relief for about 8 to 10 hours, depending on how quickly your body metabolizes the medicine. Now, after surgery, you're going to wake up in a sling. Now, you're in the sling for about a month. When you can type, write, feed yourself, things like that while you're in the sling, that's no problem. But I don't want you lifting the arm away from the body for the first month because I don't want you to stress that labral repair. The labral repair is very strong, but if you were to stress the shoulder or to fall on the shoulder, you could damage that repair in the first 6 weeks afterwards. So we'd like to protect it in those first 6 weeks. After about 4 weeks, you're going to get rid of the sling and you're going to start physical therapy. Some people will start therapy a little bit sooner, some people a little bit later, depending on if you had other things done at the time of surgery. But somewhere around 4 weeks is a good idea of when you'll start therapy. And like I said, you can get rid of the sling at the same time. Now, after surgery, you're going to have that nerve block, as I mentioned. You're also going to go home with some pain medicines, an anti-inflammatory, a non-narcotic pain medicine, Tylenol, and then some narcotic pain medicines. I want you to take the anti-inflammatory and the Tylenol scheduled for the first few days to minimize the amount of narcotics that you have to take. And when your shoulder's feeling pretty good, then you can stop taking all of those medicines. Now, there's a few things that can also help your pain after surgery. Sleeping on a little bit of an incline with some pillows behind your back can be very effective afterwards. And using some ice on the shoulder is also very effective. So whether that's a big bag of ice or an ice machine that you can purchase, either or is fine, but that'll also help your pain significantly in the shoulder. Now, the dressing you'll come out of surgery with is a big bulky dressing that's on the shoulder. That can come off after about 3 days, and then there'll be some poke holes about the size of my finger where we did all of our work through. You can shower normally after those first few days, and you can let soapy water run over these little poke holes, but I just don't want you to scrub them. When you get out of the shower, you can just cover those poke holes with Band-Aids, and that's all you really need to do. Now, of course, my physician's assistant and I are always available if you have any questions, certainly specific to your surgery, but these are just some general guidelines of things to look out for after surgery. Hope this video helps. Have a great day.